With just about a third of the world active in social technologies, it's become very, very clear that social media helps us do and fulfill that very basic human need to connect. And when it comes to health and wellness, I think we're just now starting to learn and hit our stride. So before we start our first question of the evening, I want to share with you something that Mylette, you shared with us, which I thought was just so beautiful, and I think we tweeted out today. You said, why social for health? There's a wealth of experiences, resources, options to be anonymous, and the ability to connect with a trusted group. And I thought that summarized the opportunity so well. So I'm going to ask you to elaborate on that a little bit and throw out the first question to you. Why do we see people turning to social communities when it comes to health?
Okay. One of the things that I was going to do today was ask you not to ask me the first question. Then I came in and she's like, if it's okay, I'm going to ask you the first question. So I made sure I have my notes just in case I miss out on anything, because I did want to cover a few things. So in terms of, just a wealth of information when it comes to communities, for one thing, it provides information when you need it. So especially, being the founder of IHadCancer.com, when you're diagnosed with something as awful as cancer and you feel so alone, one of the first things you do is you don't know where to go. So having a community that's pretty much dedicated to cancer and cancer experiences really kind of helps put you at ease. So that's one of the things. Aside from that, it's the ability to be anonymous. Well, you can be as anonymous as you want, or you can be as open as you want, and it gives you that ability. So you can, your profile can be a picture of a cat and no one knows who you are or anything much about you. But if you really want to be open, which our community allows, some of our communities really open about sharing their information, then it allows them to do that as well. So that's another great thing about just communities in general. And then to the other point was about making the connections with people who've been there. So the site really came about because of a personal experience that I had. I was diagnosed with cancer in 2008. At that age, my family and friends, there's no way they can really help me because they didn't go through it, so they didn't know what they can do for me. So instead, I had friends offering to talk to their mom's friends, which really wasn't aligned with where I was at that stage in my life. So it really allows you to connect with people who've been there and understand, and can really provide the guidance that you might not be able to get from your friends and family, and sometimes maybe even your doctors.
That's great. Thank you for that. Can you share with us a little bit about how I Had Cancer works?
I Had Cancer allows you to search by age, by gender, by diagnosis, for other people who've been in similar situations.
That's great. So now let's turn and maybe try to get a physician's perspective on this. I'm actually going to start with Kevin. Dr. Campbell, can you tell us why you see people going to social communities when it comes to health?
I think in this era of healthcare, we really have such limited time to interact with patients. Office visits are now trimmed to 10 minutes or less, and I cannot do the job that I owe my patients in 10 minutes. And communities and support groups and things of that sort can supplement what we do in the office. It not only connects patients, it connects physicians, it connects patients with institutions. For instance, let's say you have a diagnosis in common with another patient in this community, and you're dissatisfied with the treatment and the care that you're receiving at a particular institution. They may throw out the name of another physician at a different institution that they had a great experience with. As a physician participating in some of these communities, sometimes there may be questions out there and concerns, and I can talk about the diagnosis with these patients in a non-doctor-patient relationship way, which is important, and we'll get to that a little bit later. But I can also provide them with resources. I can also sort of get rid of any myths or misinformation out there. So I think a physician is really important part of these communities to make sure that the data that's presented is accurate. But I think that these communities are very, are most effective when they're run by patients.